Hello, my name's Kath Kelly, I'm your Chief Executive. Today we're just at the start of August actually, and I'm down here in the Dorothea unit, which is a very special unit led by Sandra and a team of about 10 nurses and healthcare assistants. And Dorothea is a very special place for patients that are coming in for treatment for chemotherapy, for oncology conditions or haematology conditions, and we see about 30 patients every day. So one of the great examples that we've got about bringing research and development closer to clinical areas is the lymphedema trial that we've got currently going on here.
What we're doing is something we've never done before, joint working with the George Eliot and the hospice, and we're measuring patients before they have axillary node clearance. Anybody whose measurements increase will be forwarded to the trial, so early treatment leads to a better response and hopefully no long-term complications from lymphedema.
So you're actually working for the hospice, aren't you? So
I am, yes.
How's that relationship with us going?
It's really good. Being involved in the research has really opened up pathways, and we've got really good close working relationships with both the chemo suite here and the breast care unit. And also I think generally the hospice and the George Eliot are doing more integrated work in. So.
Now research is really at the heart of what we're trying to do in terms of excelling at the care that we give our patients. And our team here is led by Dr. Louis David and supported by Emma, who's the manager in the research department. It's about doing things that allow us to learn more about conditions and treatments that will have a positive outcome on patient care. Last week we had our annual general meeting, which is a really important event. We probably had about between 60 and 70 people in the audience, a lot of our own staff, some of our stakeholders from the CCG, from Health Watch, and most importantly some of our patients were also in the group. Came to listen to a bit about what the last year has been about, and I'm pleased to share with you two documents, the quality accounts and the annual report for last year. You'll find both of these documents on the website, and what we've got is a really strong foundation on which we can now move forward, which is why it was so great to be able to share with the audience the launch of the clinical services strategy and the future ambition that we have for our patients and our communities around the George Eliot Hospital. The bit that we need to really maintain a focus is of course finance. And we saw last year the pressure that we put ourselves under and the level of grip and control that we now have across the organisation. I'm just asking that all of the CBU leads and everybody working across the Eliot is mindful of the importance of keeping cost under control, making sure that everything we do shows value for money and that we're working in the most efficient and effective way for our patients. We have got a lot to celebrate here at the Eliot and to be really proud of, and as you'll see in the quality accounts and the annual report, there is a lot that we can really look back on with a lot of pride. And it's about looking to the future, and it's about building our reputation and our position in the local health and social care system. What we've been doing recently is updating our intranet site so that our staff can actually access all our different services and information a lot quicker. We also have just launched the George Eliot Facebook account. This is the official Facebook account, which is on the bottom of your screen. That's the link to get to this account. We've got about 400 likes already on Facebook, and it's an opportunity for you to put out your own blogs around what great services that you're offering, all the different services and developments that you've got going on. And also we're going to put out there some adverts for jobs and jobs vacancies so that people that are looking in at the Facebook site can get access to what we have here and what we have on offer at George Eliot. For all of us at the George Eliot, let's make it all of our business to get involved with research. It has such an important role to play for our local communities here and nationally. And if you want to get involved, then please get in contact with the team in research and development and become a research champion in your area.